This empty chair represents the addict who died today, not knowing recovery was possible.
Good evening, everyone. My name is Cole Caffrey, and welcome to another episode of the Empty Chair podcast for the addict that did not know recovery was possible. First and foremost, I'd like to bring attention to Phil Leahy. He is the founder. Him and his daughter Colleen started this program many years ago so that individuals would have a place to learn, come and be educated about what resources were available for individuals. And just to, he is missed deeply. And before he passed, he asked me that to carry his picture with me, and I have kept my promise, and he is with me on every podcast, every TV show, and every event I'm at. So although his body may not be here on this earth, his presence is always with me, and that's a beautiful thing. I have some amazing guests here this evening to discuss different types of resources. So before I start, I just want to talk a little bit about why, again, we do this show. So we have a 10-year study, I don't know if you girls know this, of the numbers. In 2014, in the state of Massachusetts, there was 339 overdose deaths. In 2024, we had 2,150. And when this show started, it was actually 339. Those numbers made Senator Diana DiZoglio, Phil Leahy, and a group come together to find ways to help individuals that were struggling. So those numbers are astronomical. But then as we go on and we opened up more resource centers and everything, we started to notice a decline in overdose deaths, which is exactly what we want to accomplish by this. So in the Essex County, which is 34 police departments that collaborate together, in 2024, we had 2,944 overdoses. And of that, 124 were fatal. And those numbers, even though they're high and we don't want them, those numbers are actually much better. And it's because we have Narcan available, we have fentanyl test strips available, and we also have more recovery places than we've ever had. There was a time where someone would have to wait almost 2 weeks for a bed, and they'd have to call at 7 a.m. And all these organizations started to open up so that we would not have this issue anymore. And that brings us to tonight as to why we're here. So CARE's initiative, which is out of the Methuen Police Department, I met with 550 individuals last year that needed treatment, and these were either brought in by the police department, individuals that walked in off the street, or referrals from other organizations. And of that, 389 took a form of treatment, whether it had been a Section 35, a detox, a therapist, and that's pretty significant. That's a 16% increase compared to 2023. And in Methuen also, we had 49 reported overdose with 8 fatalities. And in 2023, we had 66 overdoses, but we had 7 fatalities. So we went up on 1 fatality, which is still one too many, but we also went down in the numbers of overdoses. But again, those aren't always being reported because now everyone carries Narcan, not everyone dials 911 anymore. So SAMHSA came up with January, this is their first year doing it, and they dedicated this month to, I just want to make sure I read it right, Substance Abuse and Mental Health Services are celebrating its first annual Substance Use Disorder Treatment Month. This month is dedicated to raise awareness of treatment options. So that's why I've collaborated with these individuals. They're all from different locations, mostly in the Merrimack Valley, southern New Hampshire, so that families could learn about, if you don't know how to get in touch with someone, these are individuals to get in touch with. We had a mom who, was afraid to call the police department, and she went on the internet and typed in detox, and the first thing that came up was like, oh, Florida, and she didn't know about it, and she sends her child to Florida, and the child dies in Florida because out there is just so much, you just don't know what you're getting, so it's best to learn the resources available. So I have Anne Marie from AdCare, Amanda from your place,
Sobriety Centers of New Hampshire.
AJ from
Serenity.
and Brett.
From Granite Recovery Centers.
So thank you so much for being here, for collaborating together. Some people may be like, well, why are they all there? They're different locations. You know what? We're all different locations, but we do have one purpose, and our primary purpose is to save a life. So I appreciate you folks being here with me this evening and taking time out of your busy lives to talk about what your organizations offer, how someone would get involved, what an individual would do if they're watching, what number would they call, or anything like that. So I just want to say welcome to the show, and actually go around and introduce yourself if you want to tell me if you're in recovery and a little bit about why you chose this field that you're in.
So Anne Marie, I'm with American Addiction Centers, and everyone knows us as AdCare in this area. I am in recovery, and I have passion to help others because of when I was in need of services, it was difficult for me to find out where to go, how to get there, and what was available. So I promised myself that if I ever made it on the other side of recovery, that I would always be there to help. And so I started seeking ways in which I could work in the industry. And lo and behold, this opportunity came up for me, and it's the perfect fit because I can really bring resources to people, and I have a story to tell, to share that there is hope and that there are people around that can give you what you need if you're willing.
Amen.
And I say willing is really the most important for those that have relatives and family members that are struggling. In order to really get them, their buy-in is most important, because oftentimes if you throw someone somewhere and they're not ready, they're going to learn something, which is a great thing. It may be a little nugget that gets them to the next level, but the real true recovery comes when you're willing to surrender.
Amen.
And I had to know it myself to be able to share that, but that's something that I like to bring to the table.
Awesome.
So-
And we call that planting the seed,
Planting
Not
seeds.
everyone always gets it, but if we're having this conversation, it may take someone first time into detox to get it. It may take their 16th time. So you are AdCare, but you also called it?
So American Addiction Centers, we have 8 facilities throughout the country.
Okay.
I am, being in Massachusetts, I mostly send people to my local facilities, which are AdCare.
Yep.
We have one in Worcester, and we have one in Rhode Island.
Nice.
So our Worcester facility is detox only. We also have outpatient programming from there, but we primarily help those who have Mass Health, which is a Medicaid,
Yep.
and Medicare A and B, and some of the Advantage plans. They can go, a lot of those places are Massachusetts restricted,
Yep.
and so that's who we really care to for that facility. Our Rhode Island facility is not only detox, but it's a true treatment center, so they call it CSS or
If
treatment.
someone's not watching right now and
Yeah.
we heard the word CSS, can
Yeah.
you tell us what that is?
So that is it is a stabilization program, which is really the true tradition of the 30-day program.
Okay.
So once a patient is detoxed, that's the next level of care. And so our Rhode Island facility will take them through a whole, they're not mandated to stay there for a full 30 days, but it is recommended. And they get treatment with a therapist, not daily, but probably 2 times a week. They go to programming all day long, and they get different types of therapy, and they get also community that, share their struggles as well, and they can find hope in that as well.
That's awesome.
Yeah.
All right.
So
You young lady, tell us a little bit why you got involved into this field and what company you're here to represent and a little bit about it.
I love it. So I'm Amanda Robichaud. Everybody usually just calls me AR.
AR-15 or AR?
Probably closer to the 15.
Depends on
I
the
got
mood.
my sights on something. It's going to be taken out, I guess. But I am representing Sobriety Centers of New Hampshire. We have a couple of locations actually up in like the Lakes region. Antrim, New Hampshire, Tilton, New Hampshire, and Laconia, New Hampshire. So like you guys, we have a detox facility and we do residential there in Antrim. And then they could step down through levels of care and go over to our Laconia Center, which is Lakes Treatment. And there they would do PHP and IOP, so partial hospital programming and intensive outpatient. I think something that's really important for anybody who's listening to know right now is regardless of which facility any of us are representing tonight, if somebody was to call me and maybe they didn't qualify for my level of care, their needs weren't going to be satisfied with us, my job is to know what everybody else's facilities offer. And that's what makes our roles really unique to the community is we are the people who are going to take on that footwork for those individuals and we're going to connect them with our Anne Marie's and our Brett's and everybody, right? Like we're gonna get you guys included and get that person to the right level of care. And to me, it's just really important because like you guys, I'm also in recovery and when I was getting sober, I didn't have these resources 15 years ago. Like these they didn't exist. It was you found what you could find. I was detoxed on a psych ward, which was terrible. And then to get sober on your own and kind of figure out everything, it was very hard. And we actually take that, legwork out of this puzzle for a lot of people, and just we really try to encapsulate somebody so that they know where they're going. It's a vetted place, it's a vetted resource. If we wouldn't send our own family members there, we're probably not going to send you there. I mean, there are instances where it's first come, first serve with beds being available, especially on those colder nights, but we're going to do everything that we can to help people get into treatment. That's pretty much it.
And your detox facility, what town in New Hampshire is that in?
That's in Antrim, New Hampshire.
Okay.
So it's probably from here, maybe an hour and a half away. We are able to help individuals with transportation because we know that can be a barrier. We also try to really keep in mind the sense of urgency, depending on somebody's situation, if they are unhoused, if they are housed, we'll keep those things in mind when putting people into treatment. I'd like to say it's a first come, first serve type of deal, but we always keep things in mind.
And you
to
also
just help
take
people.
a PPO, correct? So if an individual is a Massachusetts resident and they don't want to be in Massachusetts,
they could come out of state. We're actually in network with pretty much everybody at this point in time except for Cigna and TRICARE, but usually depending on somebody's insurance, we always ask them if we can check it for them because you never know, you might have specific benefits that allow us to work with you, or even we'll authorize a couple of weeks of care and then during that time we could facilitate with somebody else. So
awesome.
We just try to make it work for everyone.
Thank you.
I love what we do, and I know you guys do too, because we all work together. I've called every facility this week, so I know that for a fact.
Well, thank you for taking out of your time. I know you're excited to go on vacation. So thank you for this being your last pit stop.
You're the fairy godmother of recovery, and I couldn't not show up when you asked. So I hope everybody knows that, like truly does know that. She literally is the fairy godmother of recovery.
Amen. God is good. AJ, I know you flew in. You traveled the farthest from Tennessee to be with us for a local organization right here in Haverhill, Mass. That we at one time were able to have communication going back and forth. So I'm really grateful that you're here and that you're going to be hooking me up so that we have access to your facility.
Absolutely. So my name is AJ Morrow. I'm from Chattanooga, Tennessee.
We could never tell with that accent.
I'm a person in long-term recovery.
Amen.
I was in active addiction for 24 years. Homeless. Started 11 years old with being sexually molested. That was the first traumatic experience. went into gangbanging at 13 and 14. Caught my first charge at 13. And needless to say, I didn't go to multiple treatment centers. I didn't go to any hospitals. I went to prison. I was in and out of prison for quite some time. Ended up robbing pharmacies, and that was kind of my last stretch. Went on a run for a couple more years. Finally got out, decided to do something with my life, and I moved to Florida, where I was originally from. And for 3.5 years, I worked a job at Outback Steakhouse. I stayed away from drugs. I stayed away from, all the wrong things, and fished, and took care of my daughter. And lo and behold, life hit. And when life hit, I had no coping mechanisms. I had no tools. I didn't have a sponsorship family. I didn't have anybody to fall back on when life hit. So that trauma started creeping back up. And when it did, I got tired of fighting, and I tried to take my own life. I shot a gram of fentanyl and a gram of cocaine, and I woke up 12 hours later next to a black bag in the hospital, and the doctor looking at me like, I don't know how you're here right now.
Wow.
So this was 2 days before Christmas, and 7 years ago. I just celebrated 7 years January 7th.
Congratulations, yes.
I say all that to say this. I went to treatment one time. I went to treatment in Florida. I started helping people originally in Florida for a company called Harmony Recovery Group, which is now known as Harmony Health Group.
Yep.
Our flagship facility was Recovery Institute in Davie, Florida, and then we opened up a couple more in Stuart, Florida, which is Harmony Treatment and Wellness and Recovery by the Sea. And then we opened 2 more in Charlotte, North Carolina, which is Harmony Recovery Center and Midwood Addiction Treatment Center. And then I came along. And when I was in active addiction for that really long period of time, I wanted to give back to the community that I had caused so much chaos and turmoil in. And I ended up opening a center with Harmony in Chattanooga, and it was Harmony Oaks Recovery Center and Riverwalk Recovery Center. And we started out with just 10 beds, and now we're at 106.
Amen.
And we help a lot of people. And not only do we help people with substance use, but we help people with mental health disorders as well. So from that point, we expanded again into Massachusetts, into Worcester. Get a kick out. Blue Hills Recovery Center. It's a primary mental health, secondary substance use, PHP, and IOP with housing. And then we opened another facility in Tennessee, which is Summit. It's up on top of a mountain. It's on 500 acres. It's like a mental health retreat, so to speak. It's like an old bed and breakfast style, beautiful place. And it's a really good place to just kind of reset. But I would say the reason why I'm actually here to talk about your local facilities is Serenity at Summit. So Harmony Recovery Group, we purchased the Serenities in New Jersey and here in Massachusetts.
It was Delphi or something, yes?
Yes.
Okay.
So we acquired those facilities.
Yep.
So Serenity at Summit was essentially detox and substance use residential. Now it is detox and it's substance use residential, but we also do primary mental health residential because Harmony believes in treating not just the symptom, but the root of the problem as well. And I can relate to that in my own story. The root of the problem was the trauma, the molestation, the gangbanging, the being shot at, the being stabbed, the being locked up in prison, having my teeth knocked out and having to have all these replaced. Like that's traumatic. And when you go through a lot of traumatic experiences and you don't deal with it, it starts to creep up anxiety, depression, bipolar, and then people that are using drugs. You have drug-induced, schizoaffective disorder, bipolar, borderline personality disorder, PTSD, I can relate, people with OCD, sex addiction, gambling, it all ties back into mental health. That's the root of the problem. So we believe in treating the root to be able to fix the symptom. So if we can fix the root of the problem with evidence-based therapy such as individual family group counseling and dialectical behavioral therapy and cognitive behavioral therapy and trauma-focused cognitive behavioral therapy and EMDR, all those different things, it's not a one-size-fits-all treatment model for me, her, him, you. We all recover differently.
Yes.
And we realize that. So each individual that arrives at our facility, we meet them with empowerment, we meet them with affirmation, we meet them with love, and we have basically a rundown of what's going on with this person from an assessment that we did over the phone or medical records to a biopsychosocial, H&P, those types of things. And when they arrive, we customize their treatment plan. And that's how we're able to tailor that one-on-one individual that's coming in, whether it's from the street, whether it's from the sheriff's department calling, the fire department calling, working with the local drug coalitions, working with hospitals, or just the mom that's Googling detox near me and gets a Florida facility, because when they get that Florida facility, they're going to get us. And when they get us, hey, we have a local facility right here.
Nice.
And not for nothing, but I've helped a lot of people get sober in Florida.
Amen.
I got sober in Florida.
Amen.
Yeah,
You know, I got sober in my backyard in Florida, where I knew where drugs were.
yeah.
So if you really want it, if you
Yep.
want to make a change, if you want to get honest, if you want to get open-minded and willing, it's absolutely possible.
Yes, it is.
I'm proof, she's proof, she's proof, you're proof, you're proof.
Yep.
And there's people behind this camera that's proof, and
Yep.
so many countless others.
Yep.
I thank you all so much for having me on it.
Thank you. Hello, Brett.
I don't want to go last after all of them. Why, they just said everything perfectly. No, I'm so grateful to be here. I had the pleasure of meeting Cole probably like 3 or 4 years ago now, and Phil, who was amazing.
Yep.
I had the pleasure of speaking at Methuen PD a couple of times when he hosted those events. And I think it's very similar with the common theme of everybody here, right? We all care. We've all been touched by addiction and mental health in some way, whether we're personally in recovery, which I am as well. And it's really hard, right? I'm going to talk about Granite Recovery Services, who I represent, but in general, I think Amanda said it perfectly. Like, these are the type of conversations, and even if we're not physically in this room, that assist people to get into treatment.
Right.
Because we're meeting them where they're at. Right? Sometimes it may be an inpatient facility. Sometimes it might be an outpatient facility. Sometimes it might be meeting somebody and grabbing coffee with them. Sometimes it's meeting with the loved ones because, again, what Anne Marie said, I knew what my parents and my loved ones were going through, not in the moment because that was
Right.
an active addiction, but looking back on it, the sleepless nights, the trying to contact insurance providers, the being told no, like, we don't accept that insurance. We don't have bed availability. You've got to call at 7 a.m. every morning. And it can be so defeating where you're already in probably one of the biggest decisions of your life, whether it's the first time to move forward with treatment or the 16th time, and being told no left and right, or we don't provide transportation, or we don't, all of these things. So I think these collaborative type of conversations and meetings are so, so critical to actually get people the help they need, and then as close to real time as possible. Because we all know the longer it's delayed, the less likely somebody's going to move forward with treatment. So that's kind of my spiel. So focusing on Granite Recovery Centers, we have 3 main locations, 2 of those being in New Hampshire. We have a 150-bed campus in Effingham, New Hampshire, which is addiction primary. It's a full continuum of care there, so that's detox, residential, and then through that you can step down to partial hospitalization or intensive outpatient with structured living. Excuse me. We've also, as AJ touched on, about 1.5 years ago, realized the need for mental health primary. A lot of programs will focus on substance use mainly, and sometimes have programs that can work with like co-occurring or dual diagnosis. It's a completely separate physical setup when you do mental health primary. I'm not an expert with like construction or anything like that, but I know the way the buildings are set up, the locks, probably the cameras that are set up, the clinical background you need for the staff. So we were able to open up New Freedom Academy in Canterbury, New Hampshire, which is about a 50-bed program. The only one in New Hampshire that I know of that's residential treatment for mental health primary, as AJ touched on, PTSD, mood disorders, bipolar, sorry, my Boston accent came out, schizo episodes. There can be some substance use with it. A lot of the times, especially in kind of the Northeast, when recently marijuana became legal, you can see psychosis caused by things like that.
Yes.
Can't detox from marijuana, and people are kind of like, you end up at the hospital, you're talking to the police, where do I go? Sometimes it's people that have been technically sober for certain periods of time, so they don't qualify for a substance use detox, but they're at a point where they really need to reset and stabilize and get away. And then we also have a 3rd location in southern Maine, in Portland, Maine, Liberty Bay Recovery Center, which is a 50-bed program. And that's also full continuum of care, detox, residential, step down to PHP and IOP with structured living. We have other locations in New Hampshire, like we have an outpatient program in Salem, New Hampshire for our Medicaid population, because in New Hampshire we can work with all 3 of the New Hampshire Medicaids, and then in Maine it's the Maine
So
care
can you
insurance.
speak of that one, because we really don't know much about it, and you're the next town over, so are Massachusetts residents able to go there? You take regular insurance?
So for that one specifically, that program is built for our New Hampshire Medicaid population.
Okay.
And ultimately what I mean by that, I know it's kind of come up, in Massachusetts it's mainly called Mass Health.
Yep.
For anyone in the field or that's made any calls for Mass Health, it is so complicated.
Yep.
There's 100 different forms of each insurance, who accepts what. This program can accept Tufts, but it can't accept WellSense.
Yes.
So it's very, very complicated.
Yep.
In New Hampshire, it's not as complicated. There's 3 forms. We accept all of them. As Amanda probably knows, seeing a lot of it in New Hampshire is what's so much easier to work with. Yeah, so it's just easier. Ultimately, though, I still live in Massachusetts. My story is very similar to the programs I represent. I grew up in Lynn, Massachusetts. My grandfather on my dad's side passed away with over 40 years in recovery. My uncle, who's still alive, has about 37 years in recovery. I couldn't get sober around here. I just couldn't do it. There were a lot of programs, like you said, in the recent years that have opened up. I just couldn't get away from, I wasn't ready, I wasn't willing, I guess you would say. Anytime I would try like an outpatient program or maybe the Vivitrol shot, or I would do this, I'd switch to beer instead of hard alcohol because that was gonna fix everything. I was my biggest problem. I needed to get away and reset, and for me, I ended up going to a residential program in New Hampshire. I ended up relocating for outpatient and sober living up in Portland, Maine. And I really think that providing options for people really helps them, because you have to meet where they're at, right? Sometimes people are like, I need to get out of Massachusetts or whatever state I'm in. Sometimes people are like, my insurance is restricted, or I have a family, I have animals. Great, we can set you up with an outpatient. I had multiple open OUIs. People before would be like, well, I can't commute anywhere. There's telehealth options. You can join virtually. I work during the day. We have evening options. So it's really meeting people where they're at. And then, as it's been said a couple of times, collaborating. I know a lot of the times finances come up. I can't get into this program. I really don't have anywhere to live, or at least it's not healthy where I'm living. Great. We have sober living scholarships, not say our program specifically, but programs in the area we can connect you with. Maybe you've never been to an AA or an NA meeting, which I can promise you the first time I went is extremely intimidating, trying to raise your hand and say you're an alcoholic for the first time or an addict. I go to meetings with people. I try to educate them on that. Again, taking that approach of the pain that I saw cause my parents and my loved ones. I'm constantly recommending the loved ones to join like family support groups and to make sure that they're attending different things, whether it's in person or virtually, because they're going through a lot of the trauma too and a lot of that pain. But yeah, ultimately I just want to share about our programs. I know being close to the border, the New Hampshire option can be great, but if it's anything in Massachusetts, even if it has nothing to do with Granite Recovery Centers, I'm always happy to help as well.
Absolutely you are. Do any of you have a component for first responders?
Yes, we do.
Can you speak a little bit about that?
So
Are they separate from?
We have 8 different facilities, and we have 2 in Florida. One of them is a first responder that has an amazing reputation. We also have a facility that's in Mississippi and Texas. They both have first responders. Our Rhode Island facility, we gear towards a lot of vets as well. So we take TRICARE. We definitely have the ability to serve that population.
So if someone needed to go to the Florida location, how do they get there?
So they call me
Yes.
if they're in this area, and then I set them up through my intake process, which our home office is in Nashville. So they'll have another representative helping them, so 2 of us already. And we walk them gently through the whole process of what's going to happen. They generally, we cannot book their travel, but we can help them out on the backside and make sure that it's covered, and then it's included in the fee on the backside, so that we do everything we can to always take any of the barriers away. So if you present a problem to me, I'm going to try to fix it. So that the only thing left by deduction is, okay, I'll go. So, yeah.
A little bit.
Do you?
We do too. There's through Sobriety Centers, we also have a location in Tilton, New Hampshire right now. It is actually our sober living, and it's strictly for veterans, first responders, like military, anybody who's doing that type of work, like EMS. They actually go to treatment during the day at our Lakes Treatment Center. So they are in groups with some of our general population, but we are able to cultivate and kind of pull back that onion a little bit, depending on how many people are at the mountain at a time. It's sorted for 9 sober living beds right now. We don't generally stay full up there, which is, I don't know if it's a good thing or a bad thing, right? I'm a first responder's wife. So I can tell you, I see things that probably could, be treated differently, and I see a lot of the stressors that they endure with just their sleep patterns and all that jazz. So one part of me feels like there should always be 9 people in those beds, but there's not. There's just not. So we got to get a little bit better, I think, as a community and just as a whole at kind of reaching out to these individuals, which is something that I've been working on with Tara, our Massachusetts representative. This year we're really trying to get out in front of people and just kind of let them know, like, yes, you are the local heroes and you're out there saving everybody, but it's okay to raise your hand too and say you need a little bit of support, right? Because they're being so strong for everyone else always. But,
And for the two, do you have a first responders or do you?
Yes, so we can treat first responders. Being one of the therapeutic modalities that we offer is accelerated resolution therapy. So it's a fast track EMDR where you're able to focus on multiple traumatic experiences at one time. And yes, first responders have a huge stigma around them. They're the ones out saving lives. They're the heroes. They're the ones running into the fire. They're the ones running into the buildings that are, crashing down around them. And they're the ones that are witnessing just total chaos. So they can't pour into people because people aren't pouring back into them. So that's where, like, breaking that stigma, like, it's okay to raise your hand. It's okay to ask for help. It's okay to, as a man or a woman, to say, you know what, I don't have it all together. I may need to seek some form of counseling. Can it be done discreet? Absolutely, 100%. And I mean, I would say, in Massachusetts, yes, we can definitely treat first responders. In Tennessee, 100%. No shadow of a doubt.
How about you?
Yeah, and we have what is called Rally Point Recovery, so it's specifically focused, it's run and operated by former veterans, so former military who are now veterans in recovery themselves. Excuse me, similar to what Amanda said, it's probably a smaller program. We do have specific groups targeted on, if you'd say military experiences, veteran experience, a lot of times those people become first responders. So we do see a good amount of first responders through TRICARE, VACCN. What I've seen, and other people can talk about it as well, in Massachusetts and New Hampshire specifically with the VA in Manchester and then the VA in Bedford, there's a very formal process, the way that goes. So somebody has to contact their VA, whatever state that may be. Sometimes that can be a challenge, whether they're approved or not to go to, say, a private treatment center, or when they'd be approved, they have to advocate for themselves. I bring that up because a lot of the times it's providing them other resources in the area. Right in Haverhill, Veterans Northeast Outreach Center, they do weekly community meetings, they do lunch, they assist with like housing and employment. And I think that's really important because sometimes maybe somebody may not be eligible or they may not get approval to go to the treatment. There's still other options if you reach out to folks that are in our field because we see it so often. And ultimately it's the same thing. You want connection. You don't want people to feel like they're alone. And especially in those specific experiences, if you can connect with another former military member who's been through similar situations, it's going to go a long way just to have, whether you want to shoot them a text or give them a call or meet up. So it doesn't have to be formally entering treatment with somebody. I think those can go a long way too.
Nice. You mentioned twice EMDR. Can you speak a little bit about what that is and what type of individual would benefit from that type of treatment?
So people with PTSD, people with, let me use examples, people that have been molested, people that have been, in car accidents, people that have been trafficked, people that have been homeless. Those are all traumatic experiences. Those are things that happen to people that are traumatic, which sends the brain into like overdrive, overload, which can cause anxiety and all these other mental health disorders. So EMDR is eye movement desensitization reprocessing, I believe.
Sounds right to me.
Yeah.
So it's where you take your eyes and you follow the finger and you focus on one traumatic experience at a time. I'm not a therapist, I'm not a clinician.
Yep.
I'm just a person with experience that it's helped me.
Yeah.
Between that, medication management, 12 steps, and God.
But I think you said your facility offers it.
Yes,
So
yeah.
there is a therapist that would
Absolutely,
do EMDR.
yes. So it's a LMSW, so licensed master social worker. So
Yep.
all of our clinicians are master level clinicians, and EMDR is actually a special therapy that you have to be licensed for that particular therapy. And then accelerated resolution therapy is what the VA actually developed themselves. It's like an off-brand version of the EMDR,
Okay.
where you're able to focus on multiple things at one time. Because when a person has, let's say they've got 2 traumatic experiences throughout their life, they can work through that probably within the matter of a few months.
Yep.
Somebody that has 100, it may take them 5 years.
Okay.
So the accelerated part is where you're able to focus on multiple things and really able to dig in and dig through it and process through it and move through it and not just sit in it.
Sometimes they can even do that in one session. It's called art therapy too, not to confuse it with coloring and markers.
Yeah.
It's actually a really great therapy to have. I used to work for a facility that offered it as well.
Yeah.
Not to jump in here and
Well,
like
you're good.
spruce it guys up, but I want to because it is a really great therapy to have.
The
I see
EMDR.
it
The
helping
art
people.
therapy.
Art.
So
ART.
that-
ART,
Yep, ART. We used to have a clinician. He would take individuals into session, and sometimes they'd be in there. I mean, it's not a 30-minute or an hour-long session.
Right.
It could be 2, 3, 4 hours long. But basically, that individual would come out, and just an example, like they could associate the word green as being this emotional, stressful word for them, but they'd come out of that art therapy session and the word green would have an entirely different meaning. They'd have a completely different response to it. And that was some very impressive treatment to see taking place. So that's a good thing that you guys have that. It's
ACT
huge.
therapy is another one that we've noticed.
What is
And
it?
ACT therapy.
And what is that?
I don't know.
But tell us what it
But
is.
I know the expressive part of it. So like what we did, for instance, for some of the clients that were at our center. So it started off as a DBT experience, so dialectical behavioral therapy, where they planted pumpkins in a garden. And then they grew the pumpkins, and every client that would come in, they would help take care of these pumpkins, raise these pumpkins up, and then in October, it was time to get the pumpkins. So they went out and they got the pumpkins and they were processing through DBT. And then they started in with ACT and expressive therapy. And they actually, what has helped you in your treatment the most? And people were painting, their parents or their family. Some people actually did like a Mozart painting of the view off of the back deck of the mountain from the treatment center. And just seeing this artwork and seeing it tied in from the center, from the ground, from the seed. And then raising all the way up, and it's being painted, and it's just beautiful. Because if you think about it, and you think about a person like myself that's in recovery, and where I started at, and somebody planted a seed in me, and I grew, and I grew, and I grew, and then it's like fine art, painting, and just tying all that in together and seeing the reaction for people, it's amazing. To witness somebody in just a 30-day period see the light come on.
Right.
And sometimes people are on too much medication. They may come from a hospital where they're on acute stabilization.
Yep.
You called it a 35.
Section
It's
35.
It's in
So
Massachusetts.
In Florida, it's called a Baker Act.
Yeah.
Okay,
And then
yep.
in Tennessee, it's called a CON, Certificate of Need.
Okay.
So, somebody gets put into an acute stabilization because they're suicidal with a plan, or homicidal with a plan, or they're hearing voices telling them to harm themselves, or things like that. To be able to see a patient come from a hospital where they're on 13 medications because the hospital is trying to get them stabilized and get them out of there and into the next level of care, which is residential typically. And, watching that unfold, you have a person coming, yes, they're stable, like the body's physically there, and they're sitting on the couch, and they're in group, and they're not taking in anything that's going on around them. And that's the problem. The light isn't coming on. So one of the things that we offer is gene site testing, where we can take their DNA and their diagnosis, and we send it off, and within 48 hours we get a report back of what medications are going to work best for them based off of those two things. So we can take 13 medications and maybe eliminate 4 or 5 of them, and now the light starts to come on. Now they're partaking in the groups. Now they're partaking in their individual sessions. They're actually able to get honest and open-minded and have a light come on.
That's
And to see that happen in a 30-day period, it's huge.
Do any of your facilities take what he was just speaking of?
We have our Texas facility does the same.
Really?
Yeah.
That's pretty fascinating. It really is, because that would definitely help any individual that's in there on many meds. And 48 hours, we have an answer of how it works?
48 hours, of what medication is going to work best for you. You know, whether it's an SSRI or a mood stabilizer or antipsychotic or, you know, LAI, a long-acting injectable. Because some people can't take their medication. Some
Right.
people, their baseline is not necessarily like our baseline. They're more acute. Their baseline is more acute. So they can't physically take their medications. They can't remember. They might have a childlike mind. They may have autism. They may be on the spectrum.
Yep.
And they can't remember to take their medication. So we give them an injectable of the same thing, and it, you know, depletes all of that.
And is that also available in
Yes.
Haverhill?
Mental
That's
health res.
amazing.
Yes.
Amazing. Do you have
That is
anything like that
amazing.
for?
I'm gonna have to look into it now that he's showing
I
off
know.
all these fancy
I know.
tools.
Like,
Yeah,
I'll
yeah.
be sitting with my family saying, can I swab you? You need this, and you need this.
So is it bulletproof? No.
Yeah.
But it does give you a better
Understanding.
understanding of what
Yes.
can work better for you than taking all these medications and
Yeah.
you're just sitting there like a zombie.
Yeah.
It's telling what they
Or-
metabolize
Right.
best.
Yeah.
Exactly. And you know, for myself, like I know that Prozac doesn't work for my anxiety.
Yeah.
You know, Lexapro works a little bit better, so I need to take this. And you know, it's not bulletproof, but
Yes.
it gives us a good base to start with.
That's pretty amazing.
And
It is.
I'm gonna have
one
to
thing
look
I
into
will
this too.
say
Yes.
is people stayed longer in treatment
Yeah.
when we introduced that.
Yep.
Amen.
They stayed longer in treatment because we provide that full continuum from start to finish for the mental health component.
Yep.
And their therapy continues from one place to the other.
Right.
Is that insurance based, or is that like baseline for every client walking in the door?
So it's not for the gene site.
Yeah.
So for the gene site, it's anybody that okay, everybody gets gene site testing.
Right.
We offer it,
Yep.
and then it's up to the person that wants to receive it,
Yeah.
whether they want to receive it or not,
Yeah.
or if a clinician recommends it, that type of thing. But insurance will cover it, and most of the time, if insurance doesn't cover it, they'll go ahead and they'll scholarship it.
Yep.
And that's one of the cool things about GeneSight. And then also, like, you know, I think some of the pharmacies are now getting into this now because of the DNA testing.
Right. That's
I mean, it
absolutely
makes sense.
fascinating.
Totally
It eliminates
does.
a lot of people, and I don't know about the rest of you guys, but when I was getting sober, I was put on a lot of different medications that didn't work.
Right.
They'd either cause me to have extreme anxiety, panic attacks,
Yeah.
then I'd be on this one, you have to wait 4 weeks, then you can try that one, then you try this one. I mean, that eliminates you being a guinea pig
And the
or
time
feeling
frame
like it.
that you're still unstable and going
Yeah.
through the process of like, you know, trying to feel
Figure it out.
normal.
Yeah.
It takes longer than 2 weeks for
100%.
medications to
Absolutely.
level out in
Yeah.
your system.
Absolutely.
And in that 2 weeks, it's
Yep.
Well, and
It
how
can
much have you
be-
modified your own chemical makeup by taking something that you
Yes.
shouldn't be on?
Yes.
You know, that's
Yeah.
important for people to understand too, because now you have to reset your baseline before taking something else. And a lot of providers don't actually have you reset your baseline, they just give you something else.
Yes.
Yeah.
So I think that's a huge
Wow.
help.
Yep.
So years ago, we had so many barriers. We had no insurance, don't take your insurance. We had transportation. We had only one, like Hampstead Hospital was the major hospital
Yeah.
in this area. And it was mental health and also detox.
Yep.
And then we also had the Belmont McLean's. And that was it. We had one in New Hampshire I forget, it's not Sanborn Hall, that's where I work.
Is it the New Hampshire hospital, the state hospital in Concord?
But back in the day, no, it was out in Dover
Okay.
area. There was that's all we had.
Yes, I know a
So
lot
look at
of
all
people
these
from our
barriers that we
area
now
went there.
removed, right? Look at how many facilities we have, and not only are they facilities, but they are, you have your Joint Commission approval,
Yeah.
your State of New Hampshire approval, that you can have it. Now we have rides, whether you folks provide it or another service provides it. I know Essex County Outreach will give a ride to anyone to get into detox, to come out of detox. And again, the insurance piece, you take Medicare, Medicaid, you take,
Pretty much everything except for
Everything.
Medicare at the moment.
right?
Yep.
And then you folks, the insurances you take, like, this is a huge movement. And so when I think of all this, like, should be, what other barrier could one person have of getting into a place?
I think the only barrier that I would foresee would be a medical issue.
Okay?
That would be
Yeah.
the only barrier
Which is
that I
you,
could
because
foresee.
you have.
We're a
you
level
can take
4
them.
hospital,
Yeah.
Yeah, so
although
if you're
we
able to
aren't,
take,
we don't have ER. So if somebody, there are times that we still will have to say, we have to refer them to a hospital because we cannot
You
treat
utilize
that
St. Elizabeth's
emergency.
for people or
Yeah.
out in there, yes. And then for you folks,
Yeah.
you're on the campus of a hospital. Would you folks utilize that facility?
yes, we would utilize that
Yeah.
facility.
Holy
or-
family.
Yeah.
Or work within,
Yeah.
the area with our community partners to try to figure out placement for that person.
Right,
whether-
because you have people that come in that they don't
Some
think they're
people
gonna
may need-
seizure, and then they have a
Yeah.
seizure, and
Yeah.
you're like, all right, what do we do now?
Yeah.
Well, seizures we can, typically handle is the mobility aids, the
Yeah.
walkers, the
Yeah.
Okay.
canes.
Day-to-day
the-
activities.
Yeah.
Being able
Yeah.
to do your ADLs, your day-to-day activities, those types of things.
Yep.
And if you're not able to do those things, then we need to look at a different,
Yeah, a lot of
step back
places
and
don't have
look
the
at a different-
staff to handle that kind of,
Acuity.
Okay.
Yeah, yeah.
Nice.
yeah.
So, again, if someone is listening and they wanna know about AdCare, what would you give them for your information?
So I would give my card first and foremost because my number is the most important thing, because basically when you call me, I take all of the issues out of it. And
Yes,
even
you
if
do.
I can't place you, I'm going to connect you with
Yep.
one of my colleagues here. So I would give you my number, 617-418-9911.
Yep.
And you would call me, and then I would just start a conversation with you to talk a little bit about what we're dealing with. And then get the important information. I usually check insurance, whether I can take you or not, to make sure there's a valid insurance component. If not, I will connect you with a DPH bid, which
And that was
is,
another barrier, was checking the insurance would take so
Yeah.
long, and
Yeah.
now you folks all have access that you're like, bam, we can take it,
yeah,
yes.
yeah, we know exactly, are you active? If not,
Yeah.
call Mass Health, get reactivated. That'll take, 24 hours to 48 hours,
Yep.
and then we can take you in.
Amen.
So,
And what is the typical stay for, do individuals still, because back in the day, in the 80s, we did 30-day treatments, and
Yeah.
then time went on, and they would do these 5-day spin dries.
Yeah.
So if someone's
for-
coming in for detox, how long
a
are they staying
detox
with
is
you?
4 to 7 days, so
Okay.
it's a very short period of time. If they're not willing to do anything beyond that, we're handing them all kinds of resources for their community.
Yep.
But most of the time, we want to try to connect them to the next level of care. So, but it is a little difficult still.
Yep.
I would say a barrier is insurance. If you come into a detox facility and your insurance is not, I would say, not great,
Yep.
then if they don't have continuation of care, you may get stuck.
Yes,
So that becomes a little bit of a barrier.
I agree.
So we have to figure out, all right, where are we going to send these people from here?
Yep.
When you have a Mass Health plan or a Medicare plan and you're going to our Worcester facility, it's only detox.
Yep.
So we are concerned with, we have a very short period of time to make sure that you have the next level of care set up.
Yep.
Oftentimes, it's not enough time for the light to go on. You are planting seeds. So if the light goes on and you're willing to pursue more treatment, the longer you stay in treatment, the more likely you are to stay sober.
Right.
It's just facts.
And then you also have a plethora of individuals where where they would take that insurance.
Exactly.
Should they want to go to an IOP out in the
Yep.
Merrimack Valley.
Exactly. So I would connect to the next level of
Yes.
care. And so, that's
great.
basically how we
Do you
work.
folks have a website?
We do have a website. I usually give my business card, which has the QR code, because, but it is American Addiction Centers, www.americanaddictioncenter.com.
Nice.
And I have an email address, which my last name is way too long, so again, the QR code is best.
Perfect.
But I'm happy to help anyone.
Thank
so.
you, thank you. How about you, young lady? If someone's listening that I want to go to New Hampshire, what are they calling?
You're calling AR. My cell phone is 603-370-7762. I work all the time. I know everybody says boundaries. It's really great having ADHD, not gonna lie. It allows me to keep going like an Energizer bunny, so it's just great. But my cell phone is probably the best way to get in touch with me. I do have a lot of people that reach out on Facebook or through Messenger. I try really hard on Facebook and LinkedIn to post daily live updates of our bed availability.
I see it every day, and I'm like, yes, okay.
It's hard to keep up with them,
that
but
is hard.
it changes so fast. You know, you get people who are so willing to come in, and they come, and sometimes they get there and they decide that they're not ready yet, and then they'll leave despite your efforts. So I always really want to make sure that our community partners, I don't know if you're on the New Hampshire BD text thread, but
I am no longer on it.
it's a giant group of us
got booted.
all. Yeah, you got
Yeah,
booted.
I'm a mascot. I got the boot.
It's a giant text of all the New
that's
Hampshire
great.
facilities. Like, could you imagine all the treatment centers in New Hampshire have a representative on this text thread? And we give live updates daily of our beds available because, again, we get it, it's hard. If somebody is looking for a treatment and I don't have any beds available, I need to know who has a bed right now so we can get them in immediately. And
Tito Rodriguez does
Yeah.
Massachusetts.
Tito Rod.
Yeah, he puts it on press. I'm like, yes, no, I know it's
I
available.
get excited over it
Me
too. I'm
too.
like, I wonder if I'm driving these people nuts because I send so many updates each day. But again, like, you just never know. The other day it was like 40-mile-per-hour winds outside, and there were a lot of people trying to get into treatment. And just knowing right then and there, like, who had a bed, I knew somebody wasn't freezing that night. So, like, it's urgency, But, my phone number, Facebook Messenger, LinkedIn. Our web address is www.sobrietycentersofnewhampshire.com. You can also fill out a form on there or call our admissions line directly, which is 603-808-0185, and that's option 1. I usually tell people if you want to be discreet and not go through me, that's a perfectly fine option. Whatever we can do to help. Really, that's all that matters.
Thank you.
You're welcome.
How about you, young man?
So you can call my inside team. They're, another version of me, essentially. That number would be 833-293-8669.
Okay.
Or you could call me. My cell phone is 561-870-7246. I will help anyone, anytime, anywhere. It does not matter. If you have no insurance, Medicaid, Medicare, commercial insurance, it doesn't matter. I want to help. You can also reach me on Facebook at Shattered by Addiction, TikTok, Shattered by Addiction. If you want to learn or hear more about my story, there's tons of content on those pages. If you want it to be discreet or anything like that, definitely give the inside team a call. But if you want to go through me or if you want to go through Shattered by Addiction, please don't hesitate to reach out. If you get that feeling that you want to get help, run with it.
Amen.
Because next second, you may not be here.
Nice. And how about you, young man?
Yeah, to AJ's point, that window can be so small. So whatever program catches your attention, or all of us, just please reach out, even if it's educational. Like, you just want to learn more. Our website at Granite Recovery Centers is www.graniterecoverycenters.com. My personal cell is the easiest way to get a hold of me. That number is 978-979-1512. Again, LinkedIn, Facebook, all the above, similar ones. You can reach out anyway. like everyone else said, anytime. I know this isn't a Monday to Friday, 9 to 5 type of job. I'm on the phone pretty much 7 days a week, early mornings, late nights. If somebody's in crisis, even if they just want to vent, I'm available. But I would say the biggest recommendation is reach out to an individual. I think a lot of times people just kind of look at a website. They might answer some information and give you some pictures, but that human connection is so important.
Absolutely.
And like what everyone else said too, maybe the program you looked at couldn't accept your insurance, it might not be exactly what you're looking for. Reach out to somebody in the field, because it might take you hours of navigating and you don't know what the right fit will be. Reach out to somebody that's, got lived experience, they've been to treatment before, they work for treatment providers. We're always so happy to help.
Yeah,
So
I
happy
had
to help.
a mom reach out and she needed help for her loved one, and he was in Tennessee. And so now that I have now connected with you, I think you might have been a good call because I wasn't familiar with the area, and I was just reaching out to individuals saying like, where can I possibly get him in?
Yeah, I will literally go to the ends of the earth to help people. As Brett knows, like he's
He
seen me,
does too.
he's seen me drive from
You all do, you really do.
Tennessee to Florida to pick people up, bring them back to Tennessee. It doesn't matter. Like, people need help. They need help now.
Yep.
And you gotta act quick. And like I said, if I can't take your insurance or or anything like that, I'll either give you a scholarship or help you with somebody that can.
Right.
The goal is to help anyone, anytime, anywhere. And like he said, this is not a 8 to 5 or a 9 to 5.
No.
This is a 24/7, 365. Except for
Can
this
I
past
add
hour.
one thing in there too, just for anybody who is watching?
Yes?
This is for just the parents or the loved ones. Like, I know we're all helping people get into treatment, but that doesn't mean we can't help mom or dad or brother or sister talk to a therapist or a psych provider about the anxiety, the depression, the stressors that are going on in their life due to their loved ones' misuse. We all have connections with these private practices. We could easily give them a direct connection to somebody who's going to get them in right away and help them address the issues as well. Because I think that's like a really big, important piece. We focus so much on the addict, but it's a family disease, and
Thank
we
you for
got to
saying
treat
that.
everybody. So,
Exactly.
yeah, I'm like, I can't leave out the family.
Well, we've run out of time, so I just want to say thank you all for taking time out of your day. You from flying in from Tennessee. He texts me, he goes, it's cold here. Welcome. So thank you all. And for anyone that's listening out there, you can always reach out to me at the Methuen Police Department. We can hook you up with these individuals, whatever it is. And I just thank you all for being here this evening. And this was the first part of this series, and the next part will be meeting with recovery coaches from Essex County Outreach and how they can help your loved ones after they finish treatment like you folks. So thank you all for being here with us this evening. I truly appreciate it.
Thank you.
And anyone that's watching, good night and God bless.